Hello, dear Stas. Thank you so much for allowing me to record you. This is a very significant journey, everybody. Stas was quite a severe orthodontic case with a situation where we have less teeth to work with from his birth, which is it's called hypodontia, when we have a little bit less teeth to work with. And unluckily, some were positioned also very unfavorably, very close, palatally, and Stas was told to, just extract, but already he had not so many to work with. So we've basically decided to do Invisalign alignment. The journey was quite long. I remember the first batch, it was about 50 aligners, wasn't it? Yeah. But the change, I think, is really remarkable. We're going to share with images because Stas is wonderful, and he allows me to share it for educational purposes, but also for just patients to know that there are options instead of just having a surgery. So tell me, Stas, what improvements have you noticed in your own words? Yes.
It's like from beginning that everyone was saying that you need to remove these teeth, and because it's like basically we can do nothing, or we have to put metal alignment, which I never wanted.
Mm-hmm.
And of course I don't want to remove my teeth because, like Kalina said, that I don't have enough teeth, so I want to keep them, and I know that it's quite strong. So, and she offered me a new thing which I didn't know before.
Mm-hmm.
It's called Invisalign, and
Mm-hmm.
she said that it's basically you can remove them and anytime, and put back, and it won't visible. So I was like, oh yeah, let's try.
Mm-hmm.
And when she did, and I started to wear them, and it was brilliant, and basically put my teeth back how it's supposed to be, and it's improved my sleeping,
Mm-hmm.
when I'm eating, basically biting.
Wonderful.
So yeah, I'm very happy, and very important is that it's not visible, so I can wear them anytime.
Fabulous. I remember how happy you were to actually see more teeth in your smile. You can give us your gorgeous white smile.
Yeah,
There we
you can
go.
see.
Yes. There were a few teeth that were so close to the palate that they were kind of not visible.
Mm-hmm.
Yes. So your smile is so much wider, and I think also, your lower jaw, because it was able to slide forward,
Mm-hmm.
the profile of your face have changed a bit. I can see you trim your beard more.
Yeah, sure.
Yes, so the jaw just looks much more favorable in proportion to what it
Mm-hmm.
was initially. We're going to share some images so you will have a nice insight to see how things have improved. And just to check, have you noticed if any teeth became mobile or anything concern you? Because when I demonstrate that we have moved teeth so significantly, clinicians are worried that the teeth may come out, but the truth is, because the movement is so gentle, there is time to actually build bone, which is a big discussion now.
Yeah.
Hence, this video is important, and the fact that you want to share your case, I'm so grateful,
Mm-hmm.
because we want to show more and more cases, and especially those really challenging ones, that we can actually stimulate growth in adults, patients where we thought the growth is finished, that's it, but actually no, we can very gently push things a little bit further. So do tell us, have you noticed if any concern regarding the teeth?
No, it's basically it was basically setting changing sets, and it was like didn't feelings anything, like just was from beginning, and the amount how it's moved,
Yes.
and it wasn't like hurting or something. So
Correct. So there was no pain along. That's very
it's brilliant,
important.
absolutely brilliant.
This is actually a sign. If there is pain, guys, that means that we are pushing too strongly and
Mm-hmm.
bone can get dissolved.
Yeah.
If there's no pain, that means we are giving a chance for the body to build.
Yeah, and
the
more
bone.
important that you don't feel that you have them. That's
Fabulous.
one of the things.
That's
It's great.
thank you to the inventors of this lovely system,
Yeah.
because it is so much more comfortable for patients. We get those beautiful clinical benefits, but from the patient's point of view, it is important to go through that journey comfortably, where it doesn't hurt the lips and gums,
Yeah.
and we actually don't have to see each other that frequently because Stas also travels 2 hours for every session, so we can play with that a little bit more, having an aligner system.
And I think it's very important as well that to get right people, right doctors. And which Kalina, I asked her and she said, oh yeah, we're not removing anything, we'll find solution. But before I ask people, I said, oh yeah, remove all this stuff. So I'm very glad that I met Kalina and she said that we can sort it without any operation or put like metal alignments, which is, thank you so much, Kalina.
You're very, very welcome. I basically said, there's nothing we will lose by trying, that we can try. I did have the confidence. Obviously, it is a very challenging case, and even my technicians were worried, like, doctor, are they going to come out of the jaw? And I said, no, we're going to do it as I planned, and yes, so I'm just confirming a discovery that took place decades ago. It's not that I have discovered it by myself. No, I followed the understanding from the books on epigenetics and orthodontics by Professor Dave Zing, and I read the 2 books, and I thought, because the increments are so little, I'm going to go a bit further, and here we are. Teeth are still in. Stas has much more room for his tongue, has a big white smile, and eats better, sleeps better, and no surgery had to happen. So that's a lovely option. Thank you so much for the video, and we will meet you on our next session.
And 100% recommend for people who want, definitely.
Thank you so much. Thank you, Stas. Bless you.